Hey, Dr. C here with you. So I got a question from someone about their iodine levels. And they did an iodine test and they wanted to make sense out of what the results meant. So I wanted to just take a minute and show you the results, talk a bit about the testing, and explain what the various levels are and what they mean. So let's dive on in. So this will be anonymous, of course, but I'm going to pull up these levels here so you can see this. And yep, here's an anonymous version of the test results. This was done pretty recently. Now, this is pretty much the one kind of test for iodine that can be useful. And the purpose, of course, of testing iodine is to see if someone's in the right range of iodine to let their thyroid function get better. Way too much can hurt the thyroid, and being in the right window can give it a really good chance of recovering. And we've seen that somewhere around 60 to 80% of people can regain or at least improve thyroid function by regulating it. So this person had been doing so for a little bit. It turned out that she was on very high amounts of iodine through supplements for years, and that actually caused thyroid disease and a big variety of symptoms for her. So she cut back on it and wanted to see if she'd cut back on it enough to make a big difference. And these were her results. So this test is called urinary iodine to creatinine ratio. And what that means is it's the iodine in the urine, but it's compared to the creatinine levels. That's a protein the kidneys make. That makes it a little more accurate and more useful for gauging how much is left in someone's thyroid. It's not perfect. So her iodine is at 126. They measured her creatinine, and that was at 0.35, pretty normal. And so the creatinine was used to calibrate and get the iodine score. So what it should look like, the results should be in micrograms of iodine per gram of creatinine. So her question was just, what does a 126 score mean? And I'll talk about that. Now, before then, the question is, when should someone test? Say someone's struggling with their thyroid, they've got symptoms, things aren't right, and they're curious about if this is relevant for them or not. That's not a case in which they need to test. So it turns out that the iodine in your urine, your blood, and your thyroid are not all the same, and the one doesn't perfectly relate to the other. It also turns out that some of the studies in which people lowered iodine and their thyroid function got better, some of them did test iodine levels beforehand. And you would think that if the world that we lived in was logical and simple, that those who had high iodine got better by lowering their iodine, and those who didn't have high iodine didn't get as much benefit. It didn't work that way. In the tests, we saw that the likelihood of improvement was not related to the pre-test iodine levels. So there's no value on testing beforehand. But in her case, she was doing it for a while. She wanted to see if she had gotten low enough. And in those cases, it can be useful. Now, she was at 126. I'll pull the image up again real quick. And here's an image on what those numbers mean. This is from the World Health Organization. These are their iodine levels. So level 1 is where there's an overt deficiency. And this affects young children. This can be a factor for causing common goiter or congenital hypothyroidism among babies. Level 2, 3, and 4 are where we see the lowest rates of thyroid disease among adults. And if someone wishes to improve their thyroid function, they want to be in level 2 or level 3. That's this real sweet spot for getting better. And that's somewhere between typically this 50 to 99 microgram per gram range. So under 100. She wants to get under 100 to see things work better. Now, to keep your thyroid stable, you're fine up to just about 200. So where she is, her thyroid disease wouldn't likely worsen, but to really improve it, she could come down a little bit further. And then the further you are above 200, the more likely we are to see thyroid disease emerge or thyroid function worsen. So in her case out of 126, there's a couple of interpretations, and this is a case that one of my doctors work with, so I've got a sense which it is. One interpretation is that there's just a lot of iodine coming into her system still. Now, the other one is that her exposure was so high, she's not yet eliminated all of it. And in her case, she has learned. She read the Thyroid Reset Diet. She did find all the big sources. For her, most of them were supplements. She was intentionally taking over 1,000 micrograms per day. And that was what really caused her to develop thyroid disease. She's now been off of them and watching her diet per the Thyroid Reset Diet guidelines. And I'm super excited. She now has reversed her symptoms and seen her thyroid numbers completely normalize. They're better again. So if she comes down a bit further, she's got a likelihood of them staying stable. But she can even be where she is for general maintenance. So when someone does test, the goal is to be under 100 in that spot there in this green range to see thyroid disease reverse. So this this more prominent green range. And if you do end up in level 2, that's not harmful for adults. That's not where you stay long term, but that's fine for during a time of a thyroid reset. Once you really reset it, you're fine to get as high as 200. But this is the thing, it's crazy exciting how much thyroid disease can get better from this. I talked to my docs this morning, and that was one case that came up. There's another case of a woman that had Graves' eye disease, and she had Graves' disease. She was doing treatment to slow her thyroid, but the Graves' eye disease wasn't improving. Her level of Graves' antibodies was so high, it was affecting her vision. But she regulated her iodine, and within the next couple weeks, her vision started to improve. And she just saw her ophthalmologist, and now she has no signs of Graves' eye disease. So really big win. But yeah, I just wanted to go on real quick and show you guys what those results look like, what they mean, and what kind of levels are ideal to get improved thyroid function. All right, Dr. C with you. Take great care, and I'll see you again sometime really soon. Bye-bye.